Hello, good afternoon. Good afternoon. This is Dr. Velma Scantlebury coming to you live from Delaware. I am the medical director for Dialysis Patient Citizens Educational Center, and we are here live this afternoon on July 15th, trying to rush the week. Here to talk to you about whatever you would like to talk about. And so I am excited to be here. We are now in the midst of summer. I'm not sure about you, but we're having some very hot days here in Delaware. We're supposed to get up to a high of 98, which is down from 103 as predicted. And so we're only going to be in the 2 digits. So let me know what your temperatures are and where you are in this great nation. Again, we are just starting, and we will wait for some audience to come on. I know it's only 4:01, but we will hang in there while we wait for some guests to arrive, and then we will get started. So thank you, LaRonda Jones, for coming on. This is Dr. Scantlebury. Welcome, welcome. We are just opening and asking everyone where are they and what is their temperature. I am here in Delaware, and right now it's telling me it's 97 degrees on the inside, and as I drove home in my car it was 102, but then my car was sitting out in the sun for some time. So I hope everyone is staying inside. If you're hot, if your temperatures are over 95 degrees, try not to be outside. And if you're outside, if you're able to hydrate and it's not against your your physician's warnings in terms of keeping your fluid down, maybe try some frozen grapes. Those are always a good, refreshing way to cool down and also to limit the amount of fluid that you are taking in. So thank you all for coming on. Welcome, Nancy. Again, it is summertime, so I'm not sure where everyone is or where they're around, but I'm here. Nancy's here, and LaRonda is here. So if you have any questions, let me know. If not, we'll talk about how to stay healthy. And one of the things, actually, before we get there is the big buzz on the internet now is this parasitic infection that is going around as a result of outbreak of a parasite that causes diarrhea, maybe linked to lettuce and green salads. And so try to be careful. It's called cyclosporiasis. The source is unknown, and fortunately you can get pretty dehydrated for it. So because of it, if you have had any recent fruits or vegetables, or you bought any recent fruits and vegetables, make sure you wash them carefully. Soak them in some vinegar so that if they think there may be some source of parasites around, you may want to do that. Be careful with lettuce, as things can get in between the leaves, and so you may not necessarily know they're there. But if you're buying a head of lettuce or anything like that, parsley, those sort of things, I think most of the leafy greens, you want to make sure that they're thoroughly washed and inspected before you consume them. If you have tremendous diarrhea from this, you don't want to get dehydrated, so make sure that you contact your physician or your healthcare provider. Remember that most of the time it's the loose stools are frequent and explosive, so not like the regular, okay, I just ate something and I have watery diarrhea. But remember to, if it continues, if you have a few loose movements and you know you've eaten fresh fruits or vegetables, you want to be sure to reach out to your doctor to see if you if it's really, if whether you're dehydrated or whether they want to prescribe something for you. So thank you for those who joined. We're just talking about the new Cryptosporidius parasite that is in several states based on fresh fruits and vegetables. So thank you, LaRonda. It's 87 in Houston, and you have just cooled down. I guess it's better than being 98, so that's wonderful. So thank you all for joining. I'm Dr. Velma Scantlebury, the Medical Director for Dialysis Patient Citizens Education Center, and I'm here to answer your questions or just to talk in general about anything that you may be interested in. Like I said, if you're joining now, we're talking about the new parasite causing issues. So if you want to still eat your fruits and vegetables, certainly frozen or cooked is okay to be on the clear side. Frozen berries and our frozen vegetables that can have you still eating those things without worrying about whether or not you are getting that parasite. If you're experiencing a lot of diarrhea, remember it can be treated with antibiotics. But you do need a stool test to look for the organism. So again, that's in terms of keeping ourselves healthy. Remember, it's summertime, and we want to make sure that we are consuming or not getting dehydrated. I know for those of you who are on dialysis, it's oftentimes hard to minimize your fluid intake if you are on the fluid restriction. But like I said, try to freeze your fruits and try to make a puree out of the frozen fruits, which oftentimes can be very cooling and minimizes the amount of water you consume. Nancy asks a question: if seeking a transplant, how many lists should a patient try to be on? And I say that you can be on as many lists that do not overlap the same donor area, but it requires for you to be able to get to that center. It requires for you to be able to follow up in that center, as well as to be able to stay there close to that center in your post-op period while you're recovering, and in those first 2 to 3 months that you have to be on site, or at least accessible to come back to the clinic 2 to 3 days a week, depending on your clinic and depending on your numbers. So for some people, I say, if you have the means, financial means, to be listed many places and to be able to get in a plane or get in a car and drive to a different location if you're called there, but also realizing that you will need to, if you don't have any friends or relatives that you can stay with, you will have to rent a hotel, and that can be costly. There are funds out there for living donor assistance, but it requires funds for you to go back and forth for that evaluation. For instance, I am here in Delaware, and so a first patient here can list in the Delaware, Philadelphia area. There's one catchment area or one OPO. If they go outside to New Jersey, then, or North New Jersey, they have to be willing to travel that 2 hours to that location. Not bad. They can go south to Baltimore, DC, and to Hopkins or University of Maryland. Not bad, because it certainly is within the 2-hour range. But if you decide to, but if I have family that lives in Kentucky or Nebraska, I may want to list there because I may be able to stay with them and use their facilities when I come back and forth for my yearly visit. So you can be on many lists as long as you're able to get there and as long as you're able to follow up. Please explain why dialysis should never be missed and what happens when you do. Just remember, hi Arlene, how are you doing? Welcome. Just remember that dialysis is your lifeline to empty your body of those waste products that your kidneys, even if you make some urine, isn't able to get rid of. So just remember all those toxins that are accumulated in your body. When your kidneys were functioning good, 80%, 90%, 100%, whatever you eat, all those toxins were able to come out of your body. And now they're not while you're on dialysis. And your dialysis and your function is 10%, 90% of what you're consuming is being stored in your body. Extra fluids are being stored in your body. And so when you miss dialysis, you miss an opportunity for you to rinse your blood and get rid of some of those byproducts that can affect your brain, that can affect your heart, that can cause extra fluid. And if you have an issue with heart disease, can put you in a congestive heart failure. And those are things that you don't want to happen. The goal for the dialysis treatments is not perfect. It doesn't substitute nearly for a functioning kidney, but it's the best we can do, provided you stick to your regimen and allow your body to be cleansed on those scheduled times. Remember, if you're not a home dialysis and you're on hemodialysis 3 days a week, then just imagine your body being cleansed 3 days a week, even though you are consuming meals at least twice a day, every day, but yet still your body only have an outlet for that kidney excretion of waste products 3 times a week. And so there's always a disadvantage in accumulation of waste products. Some people will have complete heart stop because there's too much accumulated and the heart can't take the waste products. BUN gets so high, so it's important not to miss your dialysis because you're jeopardizing your overall life. So thank you for that question. New drugs for transplant patients that stops anti-rejection. So when we talk about anti-rejection, we're talking about the body trying to fight the rejection of your own immune system that will be attacking your body, attacking the transplant by seeing it as foreign. And so when we think about anti-rejection medicine, we're talking about, I'm not sure which new ones you're referring to. We do have monoclonal antibodies that are newer from the standard, that bottom line, cyclosporin, and Prograf, or FK506 as we used to call it. And so it would be, the goal really is to, over time, to be able to produce more or better medicine that would minimize the ability to take all of these medicines. And so currently we now have lifelong immunosuppression, but because they lower the body's immune system and requires a balance of keeping you from getting infections, but for us versus rejection, the goal really is to come up with newer medications that are able to be used for a certain amount of time to knock out your system and be able to perhaps down the line only use it for a certain amount of time, and then your body is able to take over. So the goal really is to use these new alternatives, that one of the new drugs, which is an IV medication called Velma, is used to really, as an IV infusion, to treat patients with this IV medication only after the first introduction once a month. And so once a month you would have this infusion in the hopes that it would minimize your daily need for oral medicine, but still be able to have ongoing medication. However, it hasn't been able to stand alone, so it does require some steroids with it, and the goal is to be able to get this medication to be able to not cause rejection in between the days that it's being given IV once a month. So we're still on the road to newer immunosuppressive agents and those that are more effective. But if they're more effective, remember, sometimes they come with more infections because you are wiping out your immune system in an effort to allow your body to take over and prevent that kidney from being rejected. So thank you for that question. I hope I was able to answer that. Again, I'm Dr. Velma Scantlebury. As Nancy said, welcome everyone. Arthur from Indiana. And let's see who else joined. Missy Phillips is also here. Thank you so much for coming on. So let me know if you have any questions. Like you said, we're here every third Wednesday from 4 to 4:30 out here on Facebook Live. And the goal is really to talk about how we can be of help to you, whether you're waiting on the, trying to get on the transplant list, understanding what it means to get on the transplant list. Also, looking at possible living donors. Do you have a living donor? Remember, if you have a living donor, that takes you out of the equation because then you're not competing with the thousands of patients in your area who are awaiting a deceased donor kidney. And that living donor kidney can be arranged at a time that's convenient to the donor. A lot of people opt to have it done in the summer because they're off and all. They may have vacation time that they can use up during that time, especially if their kids are out of school. And it also allows you as a recipient to have that person be your donor. If you don't match, there's also the paired organ donor swap-in, where you can go into a chain if you're not compatible by blood type, or if you are compatible by blood type, by have antibodies, you can go into a paired donor exchange where where the computer will pair you with others who have incompatible donors until they find a suitable match for both you or the number of people who are waiting. So that itself is also a consideration. And certainly it's really about, especially for those, if you are on dialysis and are older, you also have the option of receiving a hepatitis C positive donor kidney. What that means is that the donor tested positive for hepatitis B antibodies. Doesn't mean necessarily that they have hepatitis C antigen, but sometimes there's not enough time to test for the antigen. It just means they have been exposed, and it may be, as most viruses, stay dormant in your body. It does allow you, if you're a recipient and have had hepatitis C in the past, to be able to be eligible for one of these kidneys. And so you will be put on the special list willing to receive an expanded donor criteria, hepatitis C. And after you are transplanted, they will monitor you for the resurgence of any hepatitis C virus that may come from that kidney. If it does appear, you will be treated immediately with anti-hepatitis C viral medication because that is available and is a well-known treatment to eliminate hepatitis C virus. So if you're positive, you will go ahead and be treated until your blood is negative for hepatitis C. So I've just had a young lady who was receiving her third kidney transplant, knowing that she would have to wait a while, and she was willing to accept the hepatitis C positive donor kidney, and she is off dialysis. Well, she was not on dialysis. She was hovering on dialysis between her second and third kidney, but either way, she's doing well and is back home, working from home and doing well, and she remains negative for hepatitis C. So she does not need to be treated because there was no transmission of virus from the donor kidney. Just remember, the kidneys are rinsed of all the blood, but you do not, until the exudate is clear, but there may still be a few red cells lurking in the organ itself. So I can honestly say, I can't guarantee you that every single blood cell has been rinsed out of the kidneys before we transplant them. And oftentimes we have that issue with Jehovah's Witness, who wants to make sure that every single red cell is removed, but unless you examine the exudate under a microscope, I can't guarantee that. We do basically by visual, making sure that we squeeze the kidney, continue to run the fluid until the exudate is as clear as possible. So that is an option for receiving a expanded donor criteria kidney. So for many of you who are waiting for a transplant, it's something to discuss, or then probably will discuss it for you at your transplant evaluation. You don't have to take one, even if you are hepatitis C positive. There's nothing that says you have to accept a hepatitis C positive kidney, as well as expanded donor criteria by age, or even by underlying disease, as we know that there are donors who have a history of diabetes. So if you have high history of diabetes, you don't want to take a kidney from a donor who has diabetes, and oftentimes it will not be offered. If you have high blood pressure, certainly sometimes the donors will have high blood pressure, but not every donor that has high blood pressure or diabetes will have those diseases affect the kidney. And that's why we do kidney biopsies. We biopsy to make sure that there's not any severe consequences to the underlying disease, because remember, family is the ones who you're getting your information from, and not all family members are aware of their loved ones' duration of illness. In terms of, was it 10 years? Was it 20 years? What time did it start? And oftentimes it's, well, I am not quite sure. I think they have been on medication at this time, that time. So we do biopsy any person's kidneys who have high blood pressure or diabetes to make sure that there's no significant kidney damage. So thank you all for being here. Hi, Yolanda. How are you? Again, my name is Dr. Velma Scantlebury, and I am the medical consultant for Dialysis Patient Citizens Education Center, and along with my cohort, Nancy Scott, who is in the background. Thank you all for joining. We have about 7 minutes left. Is there any other questions? Tanita, welcome. Arthur, welcome. And if there are any questions, please put them in the chat so that I can address your needs. We talked for you, those of you who weren't here at the beginning, we talked about the new parasitic infection, and be careful with fresh fruits and vegetables. Make sure you wash your fresh fruits and vegetables very carefully, as we do not know the culprit quite yet. So whether it's your berries, lettuce, I would stay away from leafy green vegetables at this current time until we know the source. But if you're still eating your berries, make sure you rinse them in vinegar, baking soda, whichever suits your fancy. What I heard, I don't know, I've never seen any worms come out of my fruit, but just in case, that would be my advice. And also try, if you're squeamish, you can always use frozen fruits and vegetables. That's the easiest way to know that you're not going to contract any parasitic infections. If you do have explosive diarrhea, be sure to let your healthcare provider know, and so that they can treat you so you do not become dehydrated from your symptoms. So again, if there are any other questions, we will, what can I talk about? We talked about some anti-rejection medications. We talked about expanded donor criteria for transplantation, getting on the transplant list. 2 more, scroll up, okay. Let's see. I don't see if familial transplant drugs. Transplant drugs that stop anti-rejection. I mean, that's the whole goal of new anti-rejection medicine, is to stop rejection. So I'm not clear of your question, Nancy. New drugs on the market just came from the ASTS or the ATC, American transplant congress, and most of the newer things are monoclonal antibodies being tested. Some of them are being tested as a withdrawal medication after a certain amount of time to see if your body can accept it, with also producing chimerism by using stem cell implantation at the same time as your living donor, so that you can stimulate as well as at the same time as your donor, so that when we use the donor stem cells to inject into the recipient, it stimulates a line of stem cells from the donor's origin along with your own stem cells, so that they both then become producible in one person, sort of like a chimer. And the goal is that with that, your body no longer will recognize those donor organs as foreign, because you now have a cell line generated from your stem cells that is of donor origin. And so we have been, actually, that has been looked at for many decades now, trying to perfect that technique, that even though it may work in the laboratory, as oftentimes has not really equaled the same outcome within clinical trials. So more to come on that, and hopefully we'll get another session talking about that soon. So Tonita and Marcine, thank you for being here. If there are any questions, we're coming to the end of the 30 minutes. We want to make sure all you guys are staying, I'm not sure where you are and if you're a part of the heat wave, but make sure you indoors, you and your friends. Don't get dehydrated. Find, if you're on dialysis, find ways to be creative, to stay cool, and to not overheat, which is very easy. I had a question about potassium right after a comment from you. Okay. Potassium. All right. LaRonda, let me see where that was. LaRonda is washing, Nancy. I don't know, we may have to repeat the question. I've gone up seeking. LaRonda, just finished raining, so we have cooled down. I'm not seeing it. Starting from the beginning. What was your question? Nancy, how many lists you try to be on? Nancy Scott, LaRonda, Missy. Yeah, put your name. You're here from 4:30. What is your question about potassium? I'm not seeing it. Maybe it didn't come through. Scroll up 2 more. Nancy or Scott want to comment from you. Mendez. Honestly, I don't see it. I see LaRonda is watching. What is the comment? Maybe you can put it back in the chat for me. Now, LaRonda, I see your name, but no comments from you. I just finished. You said it was Houston, it's raining, it cooled down. That was the last comment I saw. All right, I'm sorry about that. What was your question about potassium? I'm missing that question. Maybe Nancy is going to type it again. As I am not seeing it in my queue. 2 more, scroll up. Great to see you here, Arthur. Anyway, one of the things I would say, since I don't know what the question is about potassium, is that when you come to your fruits and vegetables, especially, you want to be careful if your potassium runs high. Some salt substitutes help you control your salt intake, but it can also increase your potassium. That is so true because it is a replacement for sodium. You have sodium chloride that gets replaced by potassium chloride. So sometimes when it says salt substitute, you definitely have to be careful that you're not adding more potassium to your diet. So thank you for that. So it's oftentimes when you're trying to replace, make sure you use other spices like onion powder, garlic powder, paprika, other things that can season your foods and give them a healthy taste, some fresh thyme, basil, oregano that can replace that. So generally, I tell people to, I don't know about Mrs. Dash. We used to use it for a while, but I now have a local person who makes low salt spices in our area that we've been using. But you really do have to check to see if what your salt substitute is. And I always say it's all in the other spices that can balance your salt. And it takes really a change in your habits to totally cut out salt. Some people still don't like the taste without salt, but try to figure out what combination of other spices you play around with and make your own creation that will work for you. And if you like a little bit of pepper, that oftentimes can. And remember, lemon, onion, garlic is a great combination that can allow you to have good spices and with a little black pepper and not even miss the salt. So use those things that would be helpful to you in various combinations. So thank you so much. And I apologize for missing your question. I'm Dr. Velma Scantlebury, and I hope to see you next month. Enjoy the summer. Be well, stay cool, and stay inside unless you're in the pool. Goodbye. Have a great one.